Hello, my name is Lou Meyer. Thanks for joining us this afternoon for our talk on the Lung Cancer Screening Registry reports. Throughout this talk, I'll be referring to the Lung Cancer Screening Registry as LCSR. LCSR is one of several registries that make up the National Radiology Data Registry, or NRDR. Today, we'll cover frequency of the reports, how to access the reports, different types of reports, and an explanation of the content. Reports are issued quarterly. They include data from the previous year plus data from the current year up to the end of the quarter. Participants have 1 month following the end of each quarter to submit their data. For example, quarter 2 ended on the 30th of last month, June, so you have until the end of this month, July, to submit your data for the first half of 2019, that is, quarters 1 and 2. You access the reports by logging on to the National Radiology Data Registry website. Anyone who is a registered LCSR user at your facility can view these reports. Under the Facility Management, under the Facility Management heading on the left side of the page, you click the Aggregate Reports link. You'll see a list of reports that you have access to. You can use the filter to list only certain reports. Click the plus sign to use this feature. You can filter by registry, report category, and upload date. There are 2 report categories, facility and corporate account. A facility report includes data from one facility only. A corporate account report shows data from all facilities belonging to a specific corporate account. You'll see the registry, report category, file name, description, and upload date for each report. You can click the red download link to view and download them. There are 3 types of reports: facility, physician, and corporate. The facility report shows measures for an individual facility. It also shows measures calculated for that facility's facility type, location type, and geographic area. The physician report shows measures for individual physicians. The corporate report shows measures calculated for the corporate account, as well as side-by-side comparisons of the corporate account's individual facilities. Now we'll talk about the facility report. Here's the title page showing that this report is from March 2019. So it has all of this facility's data from 2018, as well as all data from the first quarter of 2019, provided that they were submitted before April 30th, the reporting deadline for quarter 1. There are bookmarks to the left of the report to help you navigate directly to each of the sections we'll be discussing. Next is a page summarizing the content of the report. We'll discuss each of these sections as we go through the report. Next is a map showing the geographic distribution of LCSR participants. It also shows which states are included in each census division. Your report includes measures for your census division, so by consulting this map, you can see which states are included in your census division. Next is a list of measures provided in the report and a definition of each. Continuing on, we have charts showing the distribution of LCSR participants by facility type, census division, and location type, that is, whether they're in a metropolitan, suburban, or rural area. The classification of your facility is shown at the top of each chart. So here, you see that this facility is a freestanding facility located in a metropolitan area of the South Atlantic Census Division. Now we've come to Section 1, which includes data for the current year. We refer to these as preliminary data. This is because not all follow-up data will have been entered yet, so measures requiring follow-up data, such as cancer detection rate, are not final. Here, each measure is listed with a side-by-side comparison of the results from your facility to those of LCSR as a whole. The first row shows how many exams were reported for the reporting period. All screening exams are included, not just those for Medicare patients. So this facility reported about 33,000 exams compared to 107,000 for the entire registry. But keep in mind that the data for this facility are fabricated for display purposes. We don't really have a facility that contributes such a large proportion of LCSR records. If a measure is calculated as a percentage, such as the appropriateness of screening measure on the second line, it's marked with a percent sign, and the numerator and denominator used to derive the percentage are shown. Other measures, such as the mean CTDI vol on the bottom lines, show NA instead of a numerator, since a numerator is not applicable when calculating them. The denominator represents the number of exams used to calculate the measure. So in this example, a mean CTDI vol of 3.12 was derived by dividing the sum of all CTDI vol values reported by the number of exams, in this case, 33,651. Remember that you can find a definition of each report at the beginning of the report. Sometimes we're asked why no data appear in the facility column. This is because we didn't receive any data for the relevant reporting period. For example, suppose you submitted data in 2018, but you did not submit any data in 2019 prior to the reporting deadline. Section 1, that is the 2019 section, would show no data in the facility column, but Section 2, the 2018 section, would have that column populated. Another common question is why measures requiring follow-up data, such as cancer detection rate, show up as 0. This happens when we receive screening data but no follow-up data. If you've submitted follow-up data for the relevant reporting period and still have 0 for these measures, please send us an email at nrdrsupport@acr.org so we can resolve the issue. A couple of pages down, you'll find your measures repeated, but this time compared to your peer group. Here we see this facility's measures compared to those calculated for metropolitan facilities, for freestanding facilities, and for those in the South Atlantic region. These peer groups are self-reported. If you want to change the peer group that you're included in, you can do so by logging on to the NRDR website. You must be a facility administrator to change your facility's peer group. Here's the web page where you can make the changes. Click the facility information link and select the appropriate facility category and location type. That concludes Section 1. Section 2 has all the same information, but the measures apply to the previous year rather than the current one, in this case, 2018 rather than 2019. Facility reports previously included information on measures that you could report to CMS as part of the Merit-Based Incentive Payment System, or MIPS. CMS is no longer accepting these measures, so going forward, this section will be discontinued. Next is a list of physicians for whom exams were included. It gives you information on how these physicians can use participation in LCSR to help them satisfy MOC requirements of the American Board of Radiology. The last page shows you a link to the LCSR Marketing Toolkit. Here you can download various marketing material, such as the seal of participation in various formats, a half-page ad, and a tabletop display. We encourage you to use this material to publicize your participation in LCSR and your commitment to quality improvement. That wraps up the facility report. Now we'll talk about the physician report. Here's the title page showing that this too is a report from March 2019. So it will have data from all of 2018 plus data from the first quarter of 2019, provided that they were submitted before April 30th. The physician reports don't have the introductory material found in facility reports, like the map and measure definitions. They start out with a table of measures very similar to those found in the facility report. The difference is that measures for the physician are substituted for facility measures, and peer groups are not included. You can scroll down to see a table for each of the physicians who submitted data for the reporting period. Like the facility reports, they include a section showing QCDR measures, which will be omitted going forward. The third and last report available to you is the corporate report. It's actually a spreadsheet with 3 tabs, one with explanatory material and one for each of the 2 years in the reporting period. It shows measures for the corporate account that have been calculated by aggregating the data reported from each of its facilities. Clicking the 2018 tab shows you data for each facility individually, side by side. Scrolling to the right shows you measures calculated at the corporate level. These are derived by aggregating data from the corporate accounts facilities. You also see measures calculated for LCSR as a whole. That covers the 3 types of LCSR reports: facility, corporate, and physician. Now, I'll hand it over to Amanda, who has some additional information she'd like to share with you.
Thanks, Lou. All right, guys, now we're going to go over changes that were affected with our upgrade on the 12th of July. Some of you guys may have logged in by now and noticed that the NRDR homepage is set up a little differently. So some of the upgrade changes are the aggregate report, which was redesigned, the managed scanners, smoking status on the exam form, our NRDR dashboard, and file restrictions, warning NPI message for upload, and registry access. So we've newly created a single form for facilities to access all published and interactive aggregate reports, rather than flipping back and forth between the corporate account aggregate report tab and the LCSR published aggregate reports. You can find this on the NRDR homepage under facility management, and this will display all reports assigned to that facility. The next update was to the Managed Scanners tab, which is now open for use in LCSR Registry. One key element I did want to mention was the CTDI vol. This field was added to the scanner dictionary by mistake. Until we fix this, it will unfortunately be a required field in order to save your scanner information. For now, please enter 999. Once the scanner has been added to the dictionary, the scanner will become available in the drop-down on the exam form, similar to the reading radiologist. The CTDI vol field should be removed from the Managed Scanners page within the next few weeks. I don't have an exact timeline on that, but like I mentioned, just enter 999 for now. For question 6A1, the smoking status, the LCSR form will now accept 2 decimal places for the field number of years since quit. We did touch base on this briefly during the last webinar. If it's been less than 1 year since the patient quit smoking, the leading 0 must be entered. So for example, if the patient has not smoked for 1 month, I would take 1 divided by 12, which is at 0.08. Therefore, I would just enter the 0.08. If it's unknown, you can enter 99. The NRDR dashboard or your home page now displays a summary of data submission status for each registry of each facility from all corporate accounts the user is associated with based on the current calendar year. So we've gotten a lot of tickets on this. People are kind of freaked out when they logged in because they see not submitted, not submitted, not submitted. This basically just tells you we have not received data, or we have received data for this current calendar year. So here you can see LCSR has submitted. These other registries, either we have not received data, it wasn't transmitted properly, or you guys just haven't sent it over. In order to check that, if you go to the LCSR page and click on exams, that will show you the most recent registration date. Also for upload, we have added a file size restriction up to 50 megabytes for those of you who upload your exams. Additionally, when you go to upload data for LCSR, you will now receive a warning message if the NPI does not belong to the facility or registry you are trying to upload the record to. And lastly, some of you may have already noticed when you log into the NRDR portal, you no longer have LCSR listed in the left-hand column. If this applies, please contact or submit a ticket to NRDR support at acr.org, as your facility's account has been temporarily blocked due to not receiving annual payment on time. Until payment is received, you will not be able to view or enter any patient information. Again, I strongly encourage you to log in, even if you don't have exams to enter at this time, but just to make sure that you still have access to LCSR. Otherwise, you can take care of that payment.
So that concludes our presentation for today. Here's a screen listing different sources of help that you can use for getting answers to your questions about the lung cancer screening registry, lung cancer screening coverage, or or setting up a lung cancer screening program in general. So now we're going to open it up for questions. If you'd like to enter questions in the chat box or raise your hand.
All right, so James King, I'm going to unmute your line if you wanted to ask your question. James, are you there? James, can you hear us?
Can you hear me?
Yes.
Awesome. Yeah, I was wondering, can I get a copy of this PowerPoint in email, please?
Yeah, the PowerPoint will be posted to acr.org under the LCSR page. You scroll towards the bottom, there's a section with the LCSR webinars, and that has all of our previous webinars as well.
Awesome. Also, two other questions. If you don't mind, they're real brief and easy. You may have went over this at the very beginning, but for file upload submission, the link in the current documentation available is broken. It goes to a place that doesn't exist. For the template file, the empty template file.
I didn't quite catch what link you're referring to. Could you repeat that again? We'll have it fixed.
The link to the empty template file goes to a file not found page.
All right, thanks for pointing that out. We'll have that fixed.
Yeah, it's been like that for about 2 years. But appreciate you looking into it. Nope, that's it. Thank you so much.
You're welcome. Thank you.
Amanda, could you repeat the file restriction limit for uploads?
Yeah, for upload, we've added a file size restriction up to 50 megabyte, which is about 20,000 records, so it's pretty large.
And Lou, is there a way to query the database to find the cases that are missing? Any follow-up information?
Yes, there is a link on the LCSR page under reports, and the link is entitled Exam Detail. So you can click there and download a spreadsheet that has one row for each of your exams and query your data that way.
Thanks. Allison, Kelly, I'm going to unmute your line so you can ask your questions. Can you hear us, Allison? Allison, can you hear us? Okay.
Lou, Carolyn Baguette wants to know, follow-up data is typically obtained after submission deadline. It usually takes a month to work up and diagnose. Will the reports be updated later with the follow-up information?
Yeah, the reports come out quarterly, and they will include whatever data we've received up to the last day of the reporting period. So we understand that in the last few weeks of any given quarter, the follow-up data will be incomplete, but it will be updated as you continue through the year. So, for example, we just finished quarter two, so the last few weeks of quarter two follow-up data for those exams may not be complete, but then when we issue the quarter three report, those reports will most likely have had the follow-up data entered by then, and they will be included in the report that comes out in quarter three.
Okay. Bobby Marino wants to know, after reporting to the registry, are the individual patient information retrievable? For as long as you participate in the LCSR, you should always be able to access the patient's recorded information. For existing patients, you would need to go to the well, you can actually go onto the actual exam form and use the filter to search for the patient whose records that you want to examine, and click the red exam number to open the record. I think that's what you're asking. If not, then let me know. Renee Marcelino says that she's part of an organization that has 2 facilities. Her administrator states, I am active for both facilities, but I can see the one facility in the drop-down menu. Renee, if you submit a ticket to NRDR support at acr.org, we'll have to take a look into that to see why you're only able to access one of your 2 facilities. Brandy Smedley, when follow-up yields a positive diagnosis, does it apply to the current report or when the patient underwent the screening? A follow-up can only apply to a screening. So if the patient had a positive diagnosis, then it pertains to the screening for which the patient had the follow-up.
I'm wondering if this questioner might be asking if the follow-up will appear in the quarterly report for the exam, according to the date of the exam or the date of the follow-up. If that's the question, then The answer is it appears in the quarter associated with the date of the exam.
Cindy Squire, I apologize if I mispronounced your last name. I'm going to unmute your line. Can you hear us, Cindy?
That's correct. You pronounced it correct. I was wondering, when I cannot access to register a new exam in your website, and when I go to registries, it will not let me connect. And you said something about that would be blocked if you did not get a payment from us, or did I misunderstand that?
Correct. So if you click on corporate account.
Can you hear me?
Yeah, can you hear us?
Hello?
Cindy, can you hear us?
Hello? Hello?
Cindy?
I can barely hear you. I don't know what happened.
That is correct. If you don't have access to the LCSR registry, it's likely due to your account being blocked.
How can you check?
If you click on the corporate account information tab in the left-hand column on the NRDR homepage, you should receive a pop-up or red information that says blocked. And if that's the case, then you would need to submit a ticket to NRDR support at acr.org. I believe Cindy hung up. Did we have any other questions? Melody Duffy, I'm going to unmute your line. Melody, can you hear us? Hi, Melody. All right, Pam Jennings, I'm going to unmute your line. Hi, Pam, can you hear us? Vicki Casey, did you have a question?
Hi there, can you hear me?
Yes, we can hear you.
Okay. Can you go back and review the scanner information?
Sure. So for the managed scanners, you now have to enter your scanner information there in order for them to populate on the LCSR exam form. The CTD vol was accidentally placed on this screen by mistake during the upgrade. So until we fix that, you can just enter 999 in order to save your scanner information. We're working on having this fixed, and it should be removed from the managed scanners page within the next few weeks.
Okay, because I don't recall having to set up scanners before for the LCSR. Is this something new and something that we need to maintain?
You will have to maintain it going forward. Previously, you only had to enter the manufacturer and model on the LCSR exam form, but now it's no longer like a fill in the blank on the exam form, it's a drop down. And so in order for it to populate in the drop-down, you have to enter those in the Manage Scanners tab first.
I'd just like to clarify, the way that you were entering them before is still available. This is an optional function. We had a request from users who didn't like having to enter the same data for the same scanner over and over again on multiple exams. So
Okay.
yeah, using this functionality, you can enter the data once, name that scanner and just enter that name. But you can always enter the information as you have been doing in the past.
Okay, because currently we send through an electronic submission, and so we're fine then. We don't have to come into, or nor will the rows fail if we don't come into this and build our scanners in.
Exactly. Yeah, this is not relevant if you're doing totally electronic submissions, then there's no need to pay any attention to this function.
Great, thank you.
Thanks. Pam Jennings, I still see that you have your hand up. I'm going to try to unmute your line one more time. Can you hear us, Pam? And if you guys are having a hard time speaking when we unmute your line, you can always submit a question to the question box. Melissa Bergdorf has a question. Melissa, can you hear us?
Hi, this is Dana. It might say Melissa, but I think I'm the one who answered or raised my hand. We're all calling from different offices. Can you hear me okay?
I can.
Okay, great. Thank you. Because it did say Melissa on my line. I assume that's me. I should talk. So I'm the director of the imaging department here, and we want to get started with this. So I have just a couple basic questions, if I may.
Sure.
Okay, so this presentation that we have, this is required, am I understanding that right, to start a low-dose screening program? We need to be able to have input put in here, correct?
No, it's not a requirement to start a low-dose screening program. It is a requirement to get reimbursed by CMS for your low-dose screens for screens that fit into the reimbursement requirements for Medicare patients. There's a list of those requirements, and one of them is that you submit data to a low-dose screening registry.
Okay, that makes entirely sense. Thank you. So then do you find that this registry won't help you track the patients? Facilities really should have their own internal tracking system to make sure patients are coming back on the right times for the short-term follow-ups.
Right.
Okay. So this is just to make sure that we're okay with the CMS rules to get paid for these. Okay, thank you.
Sure.
Thank you.
Just to clarify, that is one of the functions of the registry, but the main purpose is for quality improvement. So that's why we ask participants to submit all of their lung cancer screens, not just those that they intend to get reimbursement for.
Okay, and I caught on to that. The whole thing is just, for improved patient care. I definitely caught on to that. Thank you, though, for clarifying.
Sure. No problem.
Lori Chopin, can you hear us? Lori, your call has been unmuted. All right, Lori Billington, I'm going to unmute your line.
Hi, I just had a question about the corporate account that you've created the reports under the corporate account now, but can you pull the detail out of the corporate account, or do you still have to go into each one if we have multiple facilities?
I'm not sure what you mean by the detail, but the corporate account report has each of the measures for each individual facility. And there's one column for each facility, and then there's also a column that calculates the measures at the corporate account level. So could you clarify what you meant by detail?
The detailed report actually has each participant that we've entered, each exam.
Oh, I understand the exam detail. Yeah,
Right.
now I'm with you. Right. So could you repeat the question again?
So we try and balance all of what we submitted against our system. And so I have to pull each detailed report one by facility. Is there a way to pull from the corporate account, or can we work on doing that from the corporate account somehow?
We can take that as a suggestion. There isn't any way to do that right now.
Okay.
Did you have anything else?
That would really be helpful if.
I'll take it forward as a suggestion for
Thank you.
For our senior management.
Jeffrey Scott, it doesn't look like you have logged in, so unfortunately I can't unmute your line. If you want to log in, you can do that. Same with Darlene Claggett. You can log in, then I can unmute your line. A few more minutes if you guys had any questions.
Lori Billington wants to know, is there a way to pull an aggregate detail report for all facilities versus pulling the report for individual facilities one at a time?
This sounds like the question we answered previously. So we don't have a way to do that currently, but we will take that forward as a suggestion, and I'll raise it with our management.
I don't know if I'm pronouncing this correctly. Myra Mohanan, can I unmute your line?
Hi. Don't worry about the name. I just had a question. We're fairly new to this. For a category 3 and 4, the patient is no longer in the program. Is it 5 years that they need to be out, or is that a steadfast rule, or can the provider have any say in that?
Well, we don't really have the answer to that question, but if you send that to one of the, we have an Ask the Expert widget, and that's the very last line of the slide that's on display. If you go to the LCS resources page on the ACR website, there's something called Ask the Expert, and it allows you to submit a question on that subject.
Alrighty, thank you so much.
Sure.
Sue Sunil, your line's been unmuted. Sue, are you there?
Amanda, for Darlene, could you go over the QCDR measure changes for LCSR 2019?
For QCDR measures for 2019, there unfortunately aren't any. CMS is no longer accepting the measures from LCSR.
Melissa, did you have another question? Melissa Bergdorf, or Dana maybe?
Hi, yes, that written question was the one I got to handle verbally. Sorry about that. Thank you.
Oh, that's okay. You're welcome. All right, we'll give it another minute for any last questions.
Bobby Marino, the printable forms on the LCSR page that we provide, we do so only as a tool to assist you in collecting patient data. It's not required that you use those forms. They're meant only to assist you, so we don't really have anything to offer you on how you should store those, or even if you choose to store those. It's totally optional whether you use them or not. Corey Leiden, you're getting a red error, but it says the account status is not active. We would need to see that. Like Amanda said, the first thing we want you to do is check your corporate account information just to ensure that your account has not been blocked. If you determine that your account has not been blocked, if you could send us a ticket to NRDR support at acr.org, we'll take a look at your account to see how we can assist you in that area. By your account status being not active, I'm assuming that you're talking about your user account. If not, then you could let us know otherwise, and we'll help you figure that out.
Rhonda Pernstill, I'm going to unmute your line. Rhonda, did you have a question?
Corey, I'm guessing that you were asking the question for Steve. I think that's what you're saying. And I think Steve is saying that when he looks at his corporate account information, he's seeing that his account is paid and has a zero balance. So again, that's why we would like for you to create a ticket and create a ticket at nrdrsupport@acr.org so we can take a further look into your unique situation and help you from there. Because we really need to have a better understanding of what it is you're seeing. It maybe if you could provide us a screenshot of the error message, that would help us out a lot. Thanks.
Cindy Larson, I'm going to unmute your line. Cindy, did you have a question?
Carolyn Badgett, you're not able to see the LCR link on the home page because chances are your account has been blocked. Please go to the Corporate Account Information tab on the NRDR homepage to confirm your account status. And if your account is blocked, submit a ticket to nrdrsupport@acr.org, and we will assign that ticket to our operations team so that they can help you figure out how to get your account back in good standing. Rhonda Pernstill wants to know what is the appropriate lung rad version she should have.
1.1, we encourage everyone to use the latest one that just came out.
Ashley Nettles is asking where the webinars are located again. Today's webinar is not yet made available for you. We will be posting the webinar either sometime this afternoon or tomorrow at the latest, and you can find it on acr.org under the LCSR page in scroll down toward the bottom under
LCSR webinar.
Is it inside of another?
No,
okay.
There's like an LCSR drop down with all of them.
So again, that the webinar for everyone on the line, the webinar will probably be made available to you either sometime today or by COB tomorrow, and it will be on acr.org under the LCSR. Scroll down to the bottom and you'll be able to access our webinars. If for whatever reason a payment is not made in a timely manner, what happens with electronic submissions? Do they fail?
No, they don't. We continue to receive electronic transmissions.
And that was for Suzanne Norman. To answer your questions, they do not fail. They're electronic, so we would continue to receive them because they would continue to transmit. Suzanne Norman, just to clarify on the electronic submissions, we were just told that they may be suspended. Right now, we're uncertain whether your submission has failed to transmit, but we are told that failure to pay could result in a result of them not being transmitted to the ACR. So we just wanted to clarify that for you. Laurie Chapman says, right now we are not collecting height and weight. Will that affect the report since it seems to be looking for the BMI? Well, Laura, if it is a required entry on the form, then it is just that, it's required. We do expect for you to provide the information. If you don't know the information, then of course we provide you with the generic response. But I think you're asking, will that affect your report?
Yeah, so offhand, I don't remember how the reports handle that scenario. So if you could send it to us, that question to us in an email, we can get you a definitive response at nrdrsupport@acr.org.
And Melissa Orderly, I'm going to unmute your line. Did you have a question, Melissa?
Robert Champagne, in case you didn't hear Lou, we are asking that you use version 1.1, the latest version, for LCSR.
Well, that's 1.1 of LongRads. Often people get confused between the versions of LongRads versus the versions of LCSR.
Well, which one for his reporting?
Well, LongRads version 1.1 is what we want you to use, LongRads 1.1. For LCSR, you can use any of the versions that we currently offer, but 1.0 and 1.1, I think, are going away at the end of September.
Cindy, once a patient has a positive diagnosis for lung cancer, we ask that you provide the initial follow-up to that screening, but beyond that, they are no longer eligible to participate in the lung cancer screening for the purpose of CMS reimbursement. However, for ACR, we ask that you provide the information if you want to. We don't require you to, but we like to have, as part of your agreement with the LCSR, you agree to provide all lung screening. So it's up to you whether you provide that to us or not, but we welcome you to do so.
I'd like to go back and clarify the LCSR version issue. So effective September 30th, we will no longer be accepting LCSR versions 1.0 and 1.1. So at that time, starting in October, we'll only accept LCSR versions 1.2. We'll continue to accept LongRads versions, either 1.0 or 1.1, but of course, we strongly encourage you to use the most recent version of LongRads, which of course is 1.1.
Sylvia Taylor, We accept annual screenings to simplify things, we accept them at 11 months and 13 months, but we do not accept them at 10 months or 14 months. So we allow you a little bit of leeway, but that's all the leeway that we allow for that. Cindy Larson, you're saying that you have some screenings that don't qualify, but you don't submit them, but you keep them in your internal list to send reminders for follow-up exams. So again, this goes with the ACR and the LCSR. Meeting CMS requirements is not the only thing that we do. We are a quality, a quality management registry. So we want you to submit your data whether you meet CMS eligibility requirements or not. So, if the patient is asymptomatic of having lung cancer, meaning they show no signs or symptoms of having lung cancer, but the requirements that they are not meeting are more like the age requirement or the smoking history, provided that they don't have lung cancer, you are required to submit that lung screening information to the registry.
All right, our last question is, does the scanner have to be ACR accredited? And the answer to that is no, your scanner does not have to be ACR accredited in order to be a part of the lung cancer screening registry. That is going to wrap up our webinar.
Did you tell her that already?
All right, so that's going to wrap up our webinar today. If you guys have any additional questions, please feel free to submit a ticket to nrdrsupport@acr.org. And thank you again for joining. Our next webinar will be held in August, and we will send out email reminders once we have a specific date and time. Thank you.